Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. If you're unfamiliar with my work, my name is Christian Brindle. I'm a Medicare health plan expert and specialist. I'm a licensed insurance broker, and I own a company called Christian Brindle Insurance Services where we work with people in 10 states on the Medicare health plans, and we work with some of the biggest insurance companies in the industry today. Every single week, we bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Folks, we do episodes about Medicare Advantage. I start to feel like we're skewing more towards Medicare Advantage than Medicare Supplements. So then I start bringing you some episodes about Medicare Supplements, and I feel like we're ignoring the Medicare Advantage. It's kind of like a pendulum swing back and forth. And it's the age-old argument for people on Medicare. Which one is better? Medicare Advantage plans and Medicare Supplement plans. Now, while Medicare Advantage plans are increasingly more popular than they've ever been before, while Medicare Advantage plans have more of a push being made right now by the industry to kind of push you in that direction. And if you're new to the show and you're just listening for the first time, Medicare Advantage plans are those programs you see on the television, Joe Namath, all the different insurance companies that advertise $0 premium plans. Oh my gosh, $0 premium plans. Free dental, vision, and hearing. Oh my gosh. That would be Medicare Advantage plans. Now, for those of you who are unfamiliar with how Medicare Advantage plans work, Medicare Advantage plans basically work like this. Someone that picks up their Medicare Parts A and Medicare Part B. Of course, Medicare Part A and Medicare Part B are picked up through the government. Medicare Part A doesn't cost anything as long as you've worked in the country for at least 10 years of your life. Medicare Part B has a premium, currently, in 2020, as I speak to you, of $144.60 per month, unless you're in a higher income bracket, to which point they can charge you more. So any person on Medicare is on A and B. Every single person. There's no way around this. So that means if you have a Medicare Supplement or a Medicare Advantage plan, you have to have A and B. Little side note, you can pick up a Part D prescription drug plan, D for drugs, with just A or B. But who needs just a drug plan, right? Essentially, folks, the way that Medicare Advantage plans work is you're running your Medicare through a private insurance company. This private insurance company comes through, they take over, they become your primary insurance. A lot of doctors refer to them commonly as replacement plans. I don't really like that terminology, but I think it can be a good analogy, I suppose. And this insurance company takes over. They become your Medicare in a sense. And they provide you better medical benefits than what Medicare would provide to you on its own. Medicare, of course, pays 80% of medical bills. Part A covers the hospital. Part B covers the medical expenses. But Medicare on its own only covers about 80% of medical bills after the deductibles are met, of course, and leaves 20% behind for you to pay, of course, of the allowable amount, the Medicare contracted amount. But still, it can be a substantial amount of money. So Medicare Advantage plans come through, and when they take over, you're running your Medicare through a private insurance company. This private insurance company is probably going to give you medical coverage that's a lot of times significantly better than what Medicare would be on its own. The rule of thumb with Medicare Advantage plans is the coverage has to be at least as good as Medicare. At least. And 99 out of 100 of them are significantly better medical coverage than what Medicare provides. Because instead of charging 20% out of pocket, I mean, there are some things that most plans do charge 20% out of pocket for, like kidney failure, renal dialysis, chemotherapy. But the difference between original Medicare and a Medicare Advantage plan is Medicare Advantage plans come with maximum out-of-pockets. Depending on where you live, it could be $2,000, $3,000, $4,000. The highest they can be, 2020, is $6,700 out of pocket. But basically, that's for your medical expenses. Chemotherapy, renal dialysis, those two things are considered medical expenses in the Medicare world. And so they have these max out-of-pockets. You can kind of look at them as safety blankets. If you ever pay that much out of pocket, they're going to pay 100% of your medical bills for the rest of the calendar year. And then as far as the other things are concerned, hospital stays, doctor's appointments, they only charge you a copay. Could be $5 to $10 for a primary care physician, could be $30, $40, $50 for a specialist visit, $80 to $90 for an emergency room visit, could be $100 to a couple $100 per day in the hospital for the first 4 or 5 days, maybe 6 days, maybe 7 days, depending on the plan, and then they pay everything after that. Sounds pretty good, right? Comes with your drug coverage. A lot of times they'll come with extra benefits like dental, vision, hearing. Some come with more than others. They get away with advertising these plans on TV and saying, free dental, vision, hearing. But sometimes they just come with preventative dental. But technically speaking, they're not lying, because paying for a cleaning and it's included in the plan is still technically free dental, vision, hearing. We get calls from our clients every week that have Medicare Advantage plans that see these commercials, and they're like, what is this Medicare Part C? I'm like, it's what you have already. Because the advertising is out of control, and it's designed to make you think there's something new that you don't already have. It's criminal, if you ask me. Absolutely disgusting. And I think it's an absolute travesty to the retired person in the United States of America. It's disgusting. But not much I can do about it. I'm just some guy who owns an insurance agency sitting behind a mic that might be a little bit too opinionated sometimes. But I can either be opinionated or I can be quiet. I've never been very good at being quiet. Folks, I have a lot more to talk to you about this and exactly why Medicare Advantage plans get a bad rap when on paper they sound pretty good, right? Especially because Medicare Advantage plans are federally funded. Most of the time, you can get them for no premium, if not very little premium. So why do they get a bad rap? What's the downside? Well, I have to take a quick break, hear from this week's sponsor. I'll be back in segment 2, and I'll go over this topic. Don't go anywhere. Welcome back, everybody. Thanks so much for sticking with me through that break. Let's talk Medicare Advantage plans. They really, really do get a bad rap, all things considered, despite their popularity, despite their growth. It's estimated that 1 in 4 Americans on Medicare is enrolled into a Medicare Advantage plan. 1 in 4. That means 25%. This is a program that hasn't been around that long. Started in about 2005, 2006. In comparison, Medicare supplements have been around a lot longer. Now, they've gone through changes. They don't look exactly the same today as they did at the beginning, but they've been around since the 1960s. Since Lyndon B. Johnson pushed Medicare through and made it a reality. President Lyndon B. Johnson. So Medicare supplements have been around a very, 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 very long time. And the current versions we have of Medicare supplements have been around since 1992, when bills were passed to basically make it the design of the Medigap. Wrote a whole book about it called Medigap 101. Incredibly boring. If you're a glutton for punishment, go check it out. But essentially, folks, what we have before us with Medicare Advantage plans is There's a lot of working parts when it comes to a Medicare Advantage plan. There's your prescriptions you have to factor in. There are networks that you have to factor in. You have to stay in their little bubble of networks of hospitals and doctors and stay in their network. Some plans have humongous networks. Some plans have itsy-bitsy tiny networks with very few options. But others, like I said, have rich networks. It just depends on the plan. And every insurance company is going to be strong in one area and maybe not so strong in another area. So you can't just say one insurance company has all these problems fixed everywhere, or they're fantastic with these things everywhere. This is why Medicare Advantage plans get a bad rap. There are two parties to blame. Actually, I'm going to say there's three to blame. Because Medicare Advantage plans on paper are fine. There is nothing wrong with a Medicare Advantage plan. The coverage is probably better than any coverage you've had throughout your life, chances are. And that's a fact for what you pay for it. If you have a Medicare Advantage plan that's a $0 premium plan, that means that your monthly premium is $144.60 a month. If you're, of course, like most people and under the income level. Most people are. $144.60 a month. We'll round it up to $145, so we're working with round numbers. You know when the last time I paid $145 a month for my health insurance was? Never! I don't think I've ever paid that low for health insurance. And the worst Medicare Advantage plans are better coverage than my health insurance. Medicare Advantage plans are better coverage than Obamacare plans, unless you have some ridiculous subsidy to where you have a top shelf plan. Medicare Advantage plans a lot of times are better than a lot of group and retirement programs because you don't have deductibles that you have to work with on most Medicare Advantage plans. There are some that have those. Ridiculous. Don't buy them. But the coverage on them is good. It's good. It's not bad. Is it as good coverage as a Medicare supplement? No. Medicare supplements are top shelf medical coverage. But you pay more for them too. There's a real argument to be had here. Medicare Advantage plans give you a lot of stuff. Gym membership programs, over-the-counter item essentials, transportation. We already talked about the dental vision hearing. There's a lot to be had there. So why do they get a bad rap? Well, Medicare Advantage plans, like I said, have a lot of working parts. There's three parties at fault. We're going to list them off. The first one is the industry. That's right, the industry. The industry shoving Medicare Advantage down people's throats causes people that shouldn't have a Medicare Advantage plan and should have a Medicare supplement to go the Medicare supplement route, because the marketing is not to educate you on what you're buying. It's to tell you it's the best thing since sliced bread and buy it and don't ask questions. It's all in one. You don't have anything to worry about. Sign up. Who cares if your doctor's not in the network? The industry. The commercialism of it. That's the first issue. The second party at hand are agents that needlessly enroll people in Medicare Advantage plans without checking to see if it's going to be a good fit for them. There's three things that we look for in a Medicare Advantage plan first and foremost. The first thing is I want to make sure that your prescriptions are covered and covered well. How many people do you think have signed up for a Medicare Advantage plan by calling Joe Namath or calling a 1-800 number, and they signed up for a plan and find out 2 months later that their prescriptions aren't in the formulary? That's a reality. You need to have those checked out ahead of time. And when you call Joe Namath, chances are they probably won't check it out. One of these days I might have to call Joe Namath and I'll record the call or something like that, but I might get sued. I don't know. We'll have to see what happens. But anyway, prescriptions. Next, we check the doctors. Make sure that your doctors are in that plan's network. You should never have to change your doctors for an insurance plan. Never. The third thing is we want to make sure you have good medical benefits, good copays, low max out of pocket if we can help it. And in most markets, You can usually hit all three. For most people. Everybody has different needs and preferences, so that's not always a fact, but most of the time you can. So there's agents, particularly new agents, 90 to 95%, depending on your statistic, of insurance agents don't last in the business longer than 3 years. So that means that every year there's a bunch of rookie insurance agents running around that don't know what they're doing, and they're enrolling people in plans that aren't good for them because they don't know what they're doing. So, doctors, prescriptions, medical benefits. They're not being checked by a lot of insurance agents, and they throw someone on a bad plan. That's the second person involved. The third person involved that I say would be to blame, not every time, but a lot of times, is the person buying the plan. That's right, the consumer. Because they pick up the phone and they dial these ridiculous 1-800 numbers and sign up for something that they don't understand. At some point, you got to have some personal responsibility, don't you think? If you're tricked into something, if someone lies to you about something, then shame on them. You're a victim at that point. I get that. But if you see a commercial that tells you jack about what it's advertising, you don't know what the hell they're talking about, and you pick up the phone and you sign up, you give them their Medicare number, you agree on the phone on a recorded line to all the disclosures, but you don't know what you signed up for, you're part of the problem. I'm sorry. I feel for you, but you're part of the problem. Know what you're buying. Be educated about what you're buying. Every single time I've ever seen someone complain about a Medicare Advantage plan, it's because they signed up for one that didn't cover their doctor, and it wasn't checked. Or they signed up for a plan that didn't cover their certain medication, and it wasn't checked. There's always something that could have been avoided. Or maybe they were better off on a med sup. Maybe they had chronic health problems. That's a realistic thing, right? It's always because of some careless act. It's not to say that Medicare Advantage plans are bad. It's to say that they have their place. And there's certain people that should have them, and there's certain people that should not. Folks, I'll take one more break. Hear from this week's sponsor. Don't go anywhere. I'll be right back in segment 3. Welcome back, everybody. Thanks so much for sticking with me all the way to the end. My final thoughts on this topic are simple. I hope you understand where I'm coming from, and it's coming from a place with a lot of love. It's that I think if people just understood what they were getting a little bit, I think if you listen to this episode, you kind of get at least a nutshell idea of what Medicare Advantage is, way it works, what you need to look for, at least in a nutshell. I mean, if you want more details, we've done endless podcast episodes about Medicare Advantage. You can learn anything you want to know. But know what you're buying. And I like to think that this audience is very smart. I don't think people in this audience are the people that are just randomly calling 1-800 numbers, but we see it all the time. People not knowing what they're buying. Is there a small percentage of people that are tricked or misled? Yeah, you bet. But there's also a large percentage of people that sign on the dotted line willingly without knowing anything. And that's madness to me. As always, folks, I hope you enjoyed this episode. And if you did, if you're listening to us on a platform that allows you to do so, please give us a 5-star review if you liked this episode. Maybe with a little comment on something you liked about the show. I always like reading them. I always love and appreciate seeing it. And I hope you got something out of this episode that's positive. Until next time, we'll be back with you with another episode on Saturday. Have a great rest of your week and take care.